Thank you. So I'm very passionate about gender equality. I did a PhD on the topic of Romania and the patriarchy in Romania mainly, and the aspects that influence it, be them social, cultural, political, or religious. So part of that is reflected in my presentation today. Can you go for the next one, please? Next slide, please. Yes. So Romania had very interesting history about abortion law, and it's been heavily influenced by politics and ideology. So under the former regime, abortion was mostly banned, and the ban caused many women to die or to perform abortions in very unsafe situations. But after the fall of communism, it became legal again, giving women the right to decide on their own body. However, this right is only put in place in theory, because many hospitals refuse to give abortions, and many people lack the clear information on the legality of these aspects. Also, there's the topic of religious and cultural beliefs and the stigma around abortion, and generally speaking, the stigma around women deciding for themselves in so many aspects of their lives. So even though Romania is a democracy and it's part of the EU, there are still many aspects of everyday life, especially in rural areas or smaller cities, that are very much patriarchal. So, so that's to say that women still struggle to get fair medical care in terms of abortions. Can you go to the next one, please? Next one, please.
I'm sorry. I cannot do like next. Okay.
It's just the arrow on the bottom.
Okay,
Yeah.
thank you.
And next one, please. Next, the arrow.
Is that like this?
Another one?
Oh, oh, sorry.
No,
Another
no, no
one.
worries, no worries. Can you do like
This
the arrow at the bottom, please, for the next one?
this
Yeah,
one?
that's the one. So, apart from abortion, gender-based violence is still a major problem and a very widespread problem in Romania. It affects women of all ages and backgrounds and regions. One would think that maybe just people from very vulnerable situations are facing it, but statistics show that women from all environments and all like education levels face this problem. This includes a wide range of abuse, from physical to emotional to sexual abuse. Reports say that only 1 in 8 victims report the perpetrator to the authorities, and Romania has a very high rate of violence as opposed to the EU. I mean, compared to the EU, because across the EU, only 3% of women report the violence in the past year, but in Romania, it's 9%, and it's the highest rate in the EU. Women aged from 18 to 29 are especially at risk, with 7% of them reporting the abuse in the past year. However, the percentage of people that are reporting it is far less than the percentage of the people actually being abused. So, gender-based violence harms women's health rights and freedom, especially in relation to reproductive care, because many women are either beaten and raped and stuff like that, and they can't maybe get access to an abortion because of the factors that I stated before, either lack of information or social stigma or the refusal of doctors to perform abortions on moral grounds. So this stops many of them from seeking help, and it keeps them trapped into cycles of abuse and poor health. So that's why fighting gender-based violence is so essential for protecting women access to healthcare and reproductive rights. Can we do the next one, please? Let's see. So for reproductive rights and gender-based violence cannot be seen as separate issues because they're highly interconnected, as I stated before. So women that are survivors of gender-based violence, as I said, sometimes are denied the access to safe abortions, and this intensifies their trauma and keeps them trapped in abusive environments. So, for underprivileged groups such as women in rural areas or ethnic minorities, those with low income, these barriers are even higher. So, this lack of access combined with the social stigma and the institutional failures means that women are disproportionately affected by this situation. So that's why we need integrated policies to treat the problem regarding reproductive rights and gender-based violence, because this overlapping crisis requires tailored policies made by women that understand the situation. One of the other issues is the fact that Romania doesn't have a very high number of female politicians, and many times the policies regarding women are written by men that do not fully grasp the intensity of the hurdles that they're facing every day. Can we go to the next one, please? Yeah, that's the one. So diversity, equity, inclusion, and belonging are key factors for tailoring fair policies and services. So diversity means that everybody is included, from rural to urban areas to Roma to LGBTQ, and so on and so forth. Equity talks about removing barriers so someone has fair chance, especially marginalized women. Inclusion would mean that women are making active decisions in their healthcare and safety, and belonging creates a safe space for them to advocate for being supported and for survivors to speak out. So these are essential components to build a system where women can stand up for their rights. And this is a crucial piece in making lasting and meaningful progress. Next one, and I think you'll have to do two now because it or more because it goes to the uh, another one and another one, please. Yeah, that's the one. So going a bit back to the history of abortion and what started this issue, it's the fact that in 1966, during communism, there was a decree that banned abortion and contraception. Its goal was to increase the population, but it caused serious harm, and over 10,000 women died in unsafe and illegal abortion between 66 and 89. Women were also abused in the sense that they were forced to have regular gynecological gynecological checkups in order to see if they were pregnant, and if they were declared pregnant, they couldn't get an abortion. So these checkups were made in order to prevent women from getting an secret abortion. So the state controlled women's bodies through strict laws and surveillance. So this left a sense of fear and trauma and control on reproductive rights. Even today, this legacy affects how society and the medical system view abortion, and understanding the context, the historical context, would help break down the stigma and the mistrust surrounding this topic. Can you go to the next one, please? So after the revolution, the communist revolution, when Romania became a democracy, abortion was made legal. However, it was still very much stigmatized, and it didn't have like widespread free access, and many public hospitals still refused to perform abortions. So in theory, reasons include administrative rules, lack of trained staff, and doctors' personal beliefs. On the other hand, the Romanian Orthodox Church strongly opposes abortion, and also strongly opposes sexual education in school. It actually advocated a lot against several legal initiatives for making sexual education um, available in schools. And also, the pro life campaigners often use emotional messages comparing abortion to murder. They are trying to trick women into getting sort of therapy for them to realize that they're making a mistake by choosing to have an abortion. But all this sort of guidance and therapy that they're so providing, it all only leads them to having a channel for their pro-life propaganda. So that's to say that the gap between the legal rights and the real access is a major problem for the reproductive justice in Romania. Can we go to the next one, please? So the image here shows a map from 2024 in March, and it shows the differences in abortion access in Romania. The dark red areas have very little access, less than 5% in public hospitals. In some counties, the very dark red are the ones that have zero access. So hospitals don't offer this service at all, and only a few areas have a slight access, sort of 30%, but still fall short. So green areas show like decent access, but still are still very rare. Um, and as I said before, pro-lifers are pushing for mandatory counseling and waiting periods to make the access to abortion even harder. And these rules often hurt women in rural or low-income communities the most. Access to care depends heavily on where a woman lives, so it's a sort of a postcode lottery. So Roma women, poor women, and domestic violence survivors are the most affected when they're supposed to be the ones that are mostly prioritized and taken care of. So it's not only about a lack of services; it also reflects a wider judgment and neglect around reproductive rights in Romania. Next one, please. Next, please. So, as I said, social stigma is a major barrier. Oh, sorry. It's a pink one. No, back, I think, or back. No, it's a bit to the left. Sorry.
Sorry, which ping?
So, can you do like the left arrow now? Because you were doing the right one, and if you do the left, you're gonna go back
This
to
one
the
is
slides
my.
that I was.
Oh, I back to the left.
I'm sorry, what?
I'm going back this left. So
And now go right.
to the right.
Yeah. Oh no, I think no. Go left again. Sorry. Go left again.
Okay.
Left. Left again. Yeah, that's the one. So social stigma is a major hidden barrier
Oh,
in this.
the pink one.
Yeah, the pink one. So it affects access to abortion and support of gender-based violence. Over half of Romanians believe that rape can be justified in some cases, 29% of them think that victims under the influence or of alcohol or drugs are partly to blame. And 96% of rape victims in families are women, and all of the perpetrators are men. So, fear of judgment and shame stops many women from speaking up and getting help. So, these attitudes aren't just external, they're often internalized by women. So, internalized patriarchy makes some women feel guilt for assessing their rights. So, this stigma is reinforced by families, schools, the media, the church, even sometimes by the medical practitioners in healthcare settings. So many women stay silent, especially those with less money or support. So ending the stigma means more than changing laws. It requires changing cultural attitudes about gender, autonomy, and dignity. Can you do, I think, three to the right now? One, two, and then another one. There's a, yeah, this one with the chart. So wait a sec. So the chart shows a big rise in police responses on domestic violence. So progress has been made as opposed to maybe, let's say, 20 years ago. In 2020, there has been like 54K police interventions, mostly from emergency calls, and by 2023 the number has doubled to 108, and nearly 95K from emergency calls. This um, proportionally higher number does not imply that there's more violence. It's just to show that there's better reporting and awareness on it. So, all in all, Romania has improved by creating special police units, offering protection orders, providing shelters, although there's not enough shelters yet, hotlines, and support services. So these are positive steps taken by the country to tackle this problem. However, the high number also show that there's a serious, widespread gender-based violence in Romania. More needs to be done for it to stop. So responses must be survivor-centered, accessible to all, especially to marginalized groups. Prevention is also key. Um, so this issue must be addressed in order to sort of try to cut it from the root, not only tackle um, its consequences. Can you do the next one, please? So one of the or some of the things that have improved and changed over the course of the years since the fall of the communist regime is the introduction of protection orders in 2003. So emergency protection orders allow authorities to immediately remove the aggressor from the victim's home. However, up until recently, police didn't actually enforce them, and sometimes they would just say that like the couple should make up, and it's not such a big deal. Now they're more responsive a bit to the issue, and they take it more seriously. Then there was also a law in 2012 to improve mechanisms for domestic violence survivors. Uh, there are special police units created for domestic violence, and in some counties, they're handled to they're trained to handle these cases with sensitivity and spread. Although this is not a widespread sort of tactic. So there are counties in which this is not being done properly. Then there's also the integrated case management platforms Romania has begun implementing. Integrated services, police, healthcare, social services through a pilot digital system for better case tracking and survivor support. And there's also shelters and counseling services that are mostly government supported but run by NGOs that offer shelter for women and are available in certain countries, although not evenly distributed as well. So these include psychological, legal, and social support systems. It would be better to have more of these, but unfortunately, so far, it's a very low number of them. And the most recent development was the fact that in 2022, the ankle bracelet monitor was launched, and aggressors can be monitored using these ankle bracelets, helping ensure compliance with the restraining orders. Because before, even if they had the restraining order, they would break that order and go and abuse and possibly even murder their victim. So, and also there's a national strategy for combating violence against women from 2021 to 2027 that it sort of provides funding and training for professionals to raise awareness and to improve data collection in the cases of gender-based violence. And there are also educational campaigns, either from public or private entities, that are raising awareness through social media partnerships and even support from the EU sometimes. Can we go to the next one, please?
Okay, you still have like 2 minutes, Andrea.
Oh yeah, then we can skip to the fourth one, to the social innovation one. Yeah, so social innovation uses technology to fight gender-based violence, and Romania has several apps and data tools that help this. One good example is the Bright Sky app from Vodafone that offers help and info on abuse. It also has a disguise mode, so survivors can use it safely. There's also the Safe app from Code from Romania that helps assess danger and find shelters. And there are also some other tools such as VR training to teach police empathy and AI chatbots that give support 24/7 to the victims. Can we skip to the next one, please? It's a blue one linking reproductive healthcare to social justice. Next, yeah, that's the one. So the thing is, reproductive healthcare is also about social justice, not only about the healthcare aspect of it. So women facing gender-based violence are controlling their own bodies. Being able to control their own bodies is key to being safe and having freedom. So these services include leaving when these services are available, women can leave abusive situations, avoid forced pregnancies, get care without fear of shame. So this access is mandatory in order to break cycles of control and dependence. Can we do the next? And then, actually, can we skip to the next one? Yeah, and then the next one because this one's not. Okay, so technology, as I've said, is it's a very big part in addressing gender-based violence in Romania. For instance, there's like telemedicine services offered by private healthcare institutions to give access to gynecological consultation and contraceptive counseling. So these allow women to seek care privately and safely. However, these are not available to um, everybody, and maybe not people from rural areas or low income people. There's also an emergency app developed by the police that enables discreet, immediate alerts to the authorities, offering a lifeline for victims in dangerous situations. And there are also a variety of campaigns that are advocating against violence and offering tools for victims to use. Can we go to the next one, please? So, a real call to action is needed, even though progress has been made. Um, And it means bringing together key players such as policymakers, NGOs, healthcare providers, educators, and local leaders. So each group plays a key role, from shaping laws to supporting victims, to pushing for reform. But and moreover, community leaders need to shift local attitude. When these voices join forces, change is going to become powerful and lasting. It doesn't just stop at institutional level. Communities themselves have to be involved through campaigning, educating the public, and breaking stereotypes, as well as teaching the young about these aspects, and about the dangers of violence and staying in situations. So the more informed and engaged people are, the louder their voices are going to be, and the more social change they're going to achieve. So I think all these entities together can build a system that protects their rights and prevents abuse and provides equality. So that's it. Thank you very much.